Thank you. I'm Bob Grunmeyer. I'm from the Department of Biomedical and Health Informatics, and I'm going to be speaking about the Pediatric Research Consortium, which has about a 10-year history here at CHOP. I'm going to specifically focus on their activities related to research subject enrollment. There are a variety of other services that PeRC provides for the research community that we can also touch on potentially in the questions if they come up. So the Pediatric Research Consortium can help with research subject enrollment. There are a couple of different strategies that we typically use to help researchers with finding children to participate in their studies that I'd like to focus on today. They are alerts that we deliver to clinicians during patient encounters. And we also have mechanisms to deliver lists of potential subjects to researchers to help them with other enrollment strategies, which can include enrolling children in the waiting rooms of offices or mailings or other approaches. Later on in the afternoon, we'll be hearing from Chris, who will be actually talking about the Recruitment Enhancement Corps, which also provides some additional ways to find research subjects as well. I wanted to start with a little history of how PeRC ended up helping researchers with research subject enrollment. PeRC is, by the way, is an example of what's called a practice-based research network. We were originally funded by the Agency for Healthcare Research and Quality. And the idea of these networks is they bring together primary care pediatricians, or primary care providers of any type, but pediatricians in our institution, to try to support research initiatives. As we were just finding our way as a pediatric-based research network, one of the researchers here, I believe it was Judy Birnbaum, came to us and said, I need some help finding children for a study we're doing on infant nutrition. And what do you think you can help us out? So we came up with this strategy using EPIC, the electronic health record, that presents a prompt to clinicians while they're taking a dietary history on infants, which on the top half of the yellow box you can see describes a little bit about the study, much more verbose than we do nowadays, by the way. This was the first time that the primary care network had ever been involved in enrolling children in any way. And then towards the bottom, there's an opportunity for the clinician to indicate what the family's level of interest or agreement was in participating. And importantly, we made a decision early on that these alerts would not be to obtain consent for participation. It's just an opportunity for the clinician to introduce the research project to the family, as well as to obtain their information to be sent to the researcher for follow-up. And with this prompt, this was actually a multi-site study that Dr. Birnbaum was involved with. And with the introduction of these alerts, we had a tremendous success. She was able to enroll 410 children in 12 months, which very easily met her research enrollment goals. Compared to the next best performing site in this particular research network, which enrolled a much smaller number of children over a longer period of time. Site B happens to be Children's Hospital in Boston. I had de-identified that for a while, but there's a time where I could say the other institution, we'll refer to it as the second best institution. But in any event, this was back in about 2004, 2005. Since that time, we've continued this strategy of using pop-up prompts for clinicians, but we've gradually modified the approach. One thing we've done is we've changed the appearance of the prompts because now at any given time our primary care practices might be enrolling for more than 20 different studies, hopefully not an individual site enrolling for that many studies, but across the 31 primary care practices affiliated with CHOP, there could be quite a number of studies. So we've added a few graphical features, such as a little bit of a study icon, so that the clinicians can learn, oh, this is that study. They don't actually have to read the text for what it is. They can just see the icon and be reminded, oh, yes, this is Dr. Marcus's study for obstructive sleep apnea, or as shown on this screen, there's a UTI-related study called SCOUT and another nutritional study. And PeRC works with researchers to come up with the proper language. These go through the IRB as well for approval. And generally, any study can fairly easily get IRB approval to use this approach. We have learned over the years it certainly is not a great fit for all studies. where we find that it really works best is when the study itself is providing a service that the primary care clinicians perceive as being valuable for their patients. This is quite different from what the patients might perceive as valuable, because there's certainly many of the studies provide a very valuable service to patients. But if the primary care pediatrician doesn't feel like it's really doing something to improve, that may improve the health of their patients in some ways, they don't necessarily have as much interest. But for studies that are going after particular disease management issues or providing a valuable service, such as a sleep study, these prompts can work very well and can be very motivating for clinicians to refer their children, their patients. The other approach that we use fairly often is not to provide any kind of pop-up alert in the electronic health record to clinicians while they're seeing patients, but instead to provide lists of patients in one format or another. The example I've shown here, which is none of this is real data, it's all made up for the purposes of presentation. But one popular approach is actually to get a list of appointment information for a particular office. And this doesn't even need to contain anything that's considered a patient identifier. It can be appointment times and a scheduled clinician and information about a child's potential eligibility for a study. In this example here, I've chosen an example that involves asthma. And then research teams can use these lists, look across the health network, and come up with a strategy to do on-site enrollment at a particular site where they have to get special permission from both the IRB as well as the participating practices to be on the site, because you can't just show up at a primary care site and start doing research. There has to be permission from the site to be there. But generally, as long as the projects are valuable, which I think all of our researchers do valuable projects, and not overly intrusive on the office workflow, generally this can be a successful approach. It does require the study team to identify some resources for people to actually go and be at the site, and sort of assumes that you're looking for children who have fairly common conditions. If you're looking for rare conditions, then you'll be traveling all over the region trying to find one or two patients, and it may not be the effective approach. But for a condition like asthma or ADHD or any other relatively common pediatric health condition, this can be a great way to enroll subjects. These lists also can be used to generate mailings. There was a time where that was considered completely unacceptable due to concerns about how HIPAA is to be interpreted. And Chris will definitely be talking some more about some ways of reaching patients through mailings. But using a list doesn't mean you have to put somebody in an office. It can involve letters to patients, and the Pediatric Research Consortium will work with practices so the letter can be written from the child's primary care provider in some cases to the patient. Obviously, the primary care provider is not literally typing them out, but it can be structured in such a way that it basically is sent to the patient on behalf of the office saying, we want you to be aware of this research study that we think might be valuable for you, and send it back this postcard if you do or do not want to be involved, depending on whether you have an opt-in or an opt-out strategy. In general, the message I want to send is that the Pediatric Research Consortium can work with researchers to try to come up with an effective research strategy. Our primary area of focus is with the primary care network. That's where we have the greatest history. We have worked with specialty care locations, particularly ear, nose, throat, allergy, pulmonary, developmental pediatrics, and a few others to do, and ophthalmology, I believe, to use these strategies in specialty care locations to find children. But our longest standing history and our strongest relationships are with the primary care network and supporting research enrollment at those sites. I just wanted to present a little summary data. This is kind of old data. I presented it, I guess, 5 years ago or so at a conference where we just looked at different studies that had engaged in enrollment activities at CHOP and the level of success that they had. And this is where we learned that studies that are really just looking for healthy controls do not do so well with these pop-up alerts. These were all based on the pop-up alerts, not the lists of patients. The one exception was the the study that enrolled the most children, which is the Healthy Heart Study, was looking for healthy children, but the benefit of participation was you got a cardiac evaluation from the region's expert in athletes and risk for sudden cardiac death. Vicki Vetter was doing an evaluation, or one of her colleagues, on all of these kids. So they enrolled an enormous number of children, even though they were really seeking healthy children, but there was many people were very attuned to this concern about risk of sudden cardiac death, and it was perceived as a very valuable study. But in general, what we found was the studies that really did well in sort of the top half of this figure were ones that were seeking to address a clinical problem, and that the study procedures themselves offered some benefit to the patients. So just to summarize, a couple of considerations about these two strategies I've talked about, clinician alerts and patient lists. So the clinician alerts really work best when the study is providing a service that the clinicians perceive as valuable for their patients. And the sort of the gold standard in this regard is sleep studies. But there are some other examples of valuable benefits that have been provided. Patient lists are a great alternative. It can also be a supplement to pop-up prompts to try to enroll additional subjects. The UTI project that I showed on a screenshot is also using lists of children who have positive urine cultures to enroll additional children, and that's working quite well. But it does require some more human effort. It's a more potentially a more costly approach to enrolling subjects, especially if you're going to be traveling around to sites to do the enrollment on site. And then there are considerations with IRB, HIPAA, and office workflow, but generally these issues can be addressed, especially when the study is clearly addressing has an important value to it. Generally, the IRB, HIPAA, and office workflow issues can all be worked out. I think that is my conclusion. Oh, there is a website for PeRC, perc.research.shop.edu, that has a variety of information and a fairly clear intake process. If you have a study where you're interested in using the primary care network to find subjects, or in some other way work with the primary care network for a research project, there is an intake process on this website. Good question. So for the microphone, the question was, in general, what's more successful, the pop-up prompts or the lists of potential subjects? I think for studies that actually have the resources to work through lists of patients, it's a much more reliable strategy because clinicians get terribly distracted. Enrollment can be seasonal because when flu season comes in or any other sort of bolus of children, the system gets a little bit strained, and the first thing that goes from the clinician's mind is discussing research projects, even when those very projects provide an important service to their patients. So I find, in general, if I were to say to pick one approach, is if your study has the resources, using lists to find patients is probably more reliable. The pop-up alerts have been effective. I think it's always worth, if you are unsure where to put your limited research dollars, to potentially begin with the prompts, if it's felt to be a suitable candidate for prompts to the clinicians, and then layer on additional strategies afterwards if resources allow and require it. That's a good question. So regarding text message or other sort of mobile engagement with the patients to perhaps inspire them to participate in research or engage them in research activities. We have not, in PeRC, to my knowledge, actually done a sort of a text messaging campaign. There's a lot of interest in trying that out. I don't know if, Chris, if you're going to be talking about any kind of mobile phone engagement of patients. I think the consensus is we're in a period of active interest in pursuing this possibility, but nobody has done it yet. Certainly, this is something that PeRC would be interested in working with a researcher who wants to attempt this approach and work through it. But so far, we've not had anybody who has really sought to use such a strategy for patient engagement. But I think it is the right time. We know that with MyCHOP portal, for example, the online access to the electronic health record for families, that many of the people who are accessing the system are accessing it through smartphones. So it seems natural that reaching out and engaging people in research through the smartphones is a natural next step, and Apple has put out Research Kit, and there are a lot of other things on the horizon. So that was a long way of saying we haven't done it yet, but there is much interest.